Now we will be moving on to contraception. So there are two arguments: either contraception is considered wrong or contraception is considered right. There are also variations within each where certain types of contraception are considered wrong while certain are okay, and this depends upon religion or political or personal beliefs. The argument of contraception is wrong also takes into account natural law. So again, that our sole purpose that we're put on the earth is in order to procreate. Contraception can be considered unnatural or anti-life, even a form of abortion, as it prevents ovulation and subsequent fertilization in the presence of sperm. It also separates sex from reproduction. So reproduction or sex should only occur in order to reproduce. It also takes into account a consequentialist argument that contraception carries health risks, it prevents humans from being conceived, and it can be used as a form of depopulation, so decreasing the number of offspring. Sometimes an argument of immoral behavior may also be used, and it takes into account that it's easier to have sex outside of marriage and that the sanctity of marriage is violated with the use of contraception. It considers widespread sexual immorality and that having sex for pure enjoyment is not necessarily appropriate. The argument that contraception is right follows procreative liberty and expanded access of healthcare to women and men. It considers the health benefits of contraception by reducing abortion, risky abortion, or trying to undergo abortion themselves, especially in light of all of the abortion bans that are occurring. Self-managed abortion may be on the rise. So self-managed abortion would be either moving out of state or going out of state in order to obtain this type of procedure or medication, or going to a backdoor type of place. The health benefits also take into account the risks that are incurred during pregnancy, especially, again, like I said before, if the women had a very risky condition during pregnancy, such as eclampsia or HELLP syndrome or extensive clotting or any of those other risks. It takes into account that a family and childcare is an extreme financial burden, and it also takes into account the thought of gender equality and can be even thought to control world poverty by decreasing the financial burden associated with unintended pregnancy. It also takes into account the argument of virtue ethic, and this is defined as the obligation to not become a parent if you know you would not be a good one. So if you feel like you would not be a good parent, it is your obligation to not become pregnant and use contraception, and that's what virtue ethic is considered. Whether or not you agree with that argument is, again, up to you. Different religions have different stances upon contraception and whether or not they're appropriate. So, for example, Christianity, depending on the type, so for example, Protestant versus Roman Catholic, they may vary depending on the type, what is considered appropriate for contraception or not. So it varies. Some say only can use contraception if you're married, and that it doesn't, in order to not promote promiscuous behavior. The Roman Catholic Church traditionally has said natural birth control only, so that would include natural family planning methods such as the rhythm method or day counting, only avoiding intercourse during fertile days, so they could use the Natural Cycles app in theory. And then this varies dependent on the type of religion. So like I alluded to before, a lot of these topics of women's health, we have to balance both our own personal beliefs, and that might be religious beliefs or other ethical beliefs that we feel are right, with the protections of patient access. So this takes into account beneficence and patient autonomy, in that we should really be protecting patient access to care that they choose to have. We are allowed to have our own beliefs regarding contraception, emergency contraception, sterilization, abortion, what have you, but we should be able to protect, as a healthcare provider, patient access to the care that they choose to have. So we really need to strike a balance between those two things. Emergency contraception, we've talked about these types in the past in both self-care and in therapeutics, but there's Plan B, ulipristal, and the copper IUD. Plan B is often not considered a form of abortion or that it would interrupt an existing pregnancy, but depending on the group, they may consider that because this is inhibiting ovulation and conception, they may not agree with Plan B. Ulipristal and the copper IUD may have some effects either on the endometrium or affect implantation, and more often are considered a negative, and groups may not choose to support the use of ulipristal and copper IUD because they are more likely to inhibit implantation of a fertilized egg. So they might be considered closer to a medication causing an abortion than Plan B would be. You can take a look at that video. I believe we watched it last year, but this talks about the science of Plan B and how it's actually working mechanistically, and how it should not be medically considered a pill that can cause an abortion because it prevents ovulation, so no egg and sperm ever come into contact. So some considerations are that according to the NIH and ACOG, pregnancy begins when a fertilized egg implants. So we talked about that in the beginning. So emergency contraception will not work if someone is already pregnant, medically defined, although, like I said, different groups will define this differently. Some things to consider as well is, do you have the right to refuse if a patient has a prescription for a levonorgestrel, emergency contraception, or ulipristal? Or should you fill all valid prescriptions regardless of personal beliefs? So this takes into account the pharmacist code of ethics. So when we took our oath, we promised honesty and integrity, and that we would respect and value the abilities of colleagues and other healthcare professionals, and then serve the individual, community, and societal needs. So this doesn't necessarily take into account our personal beliefs regarding whether or not something is considered right, but that we would respect others' values, and that we would serve individual patients, the community, and the society by providing access to care. The Hippocratic Oath is something that we should also consider, in that it says, do no harm. So do no harm, is that to human life? When do we define the start of human life? Other considerations about emergency contraception are, again, the argument that this is population control by decreasing risk of unintended pregnancy by using emergency contraception. And then the consideration of rural pharmacies. We'll talk about that a little bit when we get to pharmacist's right to refuse. And then another consideration are minors. So the age of consent varies depending on the state. So what might be the role of parents, families, and societal teaching regarding sexual intercourse and the use of emergency contraception? The last section about contraception talks about insurance coverage. So under the Affordable Care Act in 2010, this expanded several state policies that federal contraceptive coverage would be guaranteed and applied to most private healthcare plans that were available nationwide, whether or not it was for an employer, a school, an individual, or a self-insured patient. So this would guarantee coverage of several different methods of contraception for women, including female sterilization, so that's tubal ligation, counseling and services, and didn't cover some other forms of contraception. So some states have amended their requirements to match that federal guarantee, but not all of them have. So more recently, in October 2017, the Trump administration made it easier with some legislation for employers to exclude contraceptive coverage from health plans. So this would be, for example, like Hobby Lobby. I posted in the resources about their their court case in which it was ruled that they were allowed to refuse to cover certain contraceptive services for their employers as part of their insurance program, and this is considered part of a religious freedom act. So it's important to consider the type of company that you're ending up working for as a pharmacist and whether or not the insurance that you garner from them will cover different contraceptive services and which ones, if not all, they would cover, and whether or not it's for free or with a copay. So this will vary. In regards to legislation for contraception, 12 states allow healthcare providers to refuse to provide different types of contraception. 9 allow them to refuse to provide services related to contraception. So this might be counseling or placement of different contraceptives like IUDs or implants. 6 states explicitly permit pharmacists to refuse to dispense contraceptives. And 8 allow healthcare institutions to refuse to provide services of contraception. So this could include hospitals. The last major section is sterilization. Sterilization would either include a vasectomy or it would include tubal ligation, which is like women getting their tubes tied in order to permanently inhibit the ability for fertilization to occur. Again, arguments against it apply natural law reasoning. So then again, that is that our sole purpose on this earth is in order to procreate. So certain states allow healthcare providers to refuse to provide sterilization services, so either vasectomies or tubal ligation. And then 16 states allow them to refuse, institutions to refuse sterilization for limited exemptions to private entities. So that would be like a specific private, non-public type of hospital. So we talked about what sterilization occurs and basically that how they would work and how they're completed. So that's important to note if you didn't know that. So tubal ligation, it closes off the fallopian tube. So the woman would still ovulate, but the egg would never come into contact with sperm. So there's a couple ways this can be done. A vasectomy is when the vas deferens of either one or two of the tubes that carry sperm to the testes are either tied, cut, or clipped or sealed off in order to prevent the release of sperm. This is how it's done, and then it takes about 2 to 4 months in order for semen to become sterile or completely free of sperm, and then men often have to undergo a test under which the semen sample is analyzed for sperm counts. Sterilization is considered permanent birth control and is not really meant to be reversible. So this would be considered a more, extreme form of contraception. The pharmacist's right to refuse. So the following video will go through a pharmacist's right to refuse all the different types of services that we've talked about prior to this.